Good morning, everyone. Today is Sunday, June 8th, 2025, and I'm sitting here having my morning coffee. This past week, I completed my first week of returning to work, and I feel very good. And this week was a little tough because I had to wake up early. The training schedule was just normal business hours, 9 to 5, which which means or which meant that I had to wake up early every morning to be there, and something that I have not done in about 6 years. So that was a little tough, but I got through it, and the training wasn't very hard. Well, there was a lot, and so those who haven't been watching, um, but I guess maybe almost 5 months. In fact, June 11th will make 5 months since my transplant, and my first day back on the job was Monday, June 2nd, and it's interesting because the last day I worked was it was June 9th, 2021. So almost exactly 4 years, 4 full years that I had not worked and dealt with this kidney disease. So just under 5 months, I'm officially back at work, and I feel better. Just the fact that I did a 40-hour work week. And so, and it was tough being up all day, but like I said, I got through it. And tomorrow, Monday, my normal work schedule will begin, which is it's 3 p.m. to 11 at night, and it pays a little more because it's the least popular schedule, but unbeknownst to them, that's a schedule that works for me. And so I'm happy to have it. I'm very happy to have it. I can just, go to sleep. It'll probably be midnight, maybe 1 that I go to sleep, but I can wake up whenever I feel like it. Because I'll naturally be up by, 11 or 12. And so that works for me. And so that'll give me time to go to the gym, get a little bit of exercise, and then get ready for work and be there at 3. So again, first week back at work, it feels real good for me at least. And as far as the benefits go, this is considered a trial period, and to see if I can work. And now I'll admit, going into this, I was a little anxious. I wasn't sure if I was going to be able to stay up all day, and but because I was engaged in something, my mind was thinking, that helped me stay awake. And there was a lot of reading and going through rules, procedures, and getting familiar with the facility. And one thing I like about the facility is they have a gym, so I can use that, or if I want to go to my normal gym, and which is one of the benefits they have. And I get a free membership at my normal gym, which I already do through Medicare. I get a free membership, but whenever I'm off of Medicare, my free membership at my normal gym will continue, because that's one of the employer benefits. So anytime, all these hospital employees get pretty good benefits and not a lot of nice perks. So that's nice. And So, but I think it's just kind of funny, I guess maybe ironic that, the hospital where I receive all my treatment, I'm now working for them. And so, yeah, it's kind of crazy. And so, but no, yesterday when I was in the gym, the guy came up, and I hadn't seen him in quite a while. And I recognized him, and I said, "Hey, how you doing?" And he said, "Oh, doing fine. How are you doing?" And I said, "I'm not sure if I told you, but I received a transplant," because he knows we talked a bit in the gym. And he said, "Oh, wow." He said, "I noticed your face is different. Your color is back." I said, "Yeah, yeah, it happened, you know, um, January 11th on a Saturday night." And he said, "Oh, wow." So he was thinking, "Yes, I'm about 4 or 5 months ago." And I said, "Yeah." And I said, "I just started my new job. This was yesterday, Saturday." So I said, "I just started my new job this week. So I did 40 hours." He said, "Oh, wow. Where are you working?" I said, "Well, it's kind of maybe a little crazy, but I'm working at the hospital, and they hired me." And he went, "Wow, that's interesting." And so we talked for a few minutes, and but I hadn't seen him in a while. He's not quite a regular as someone like me, but yeah, I had a good week, and I feel great. And yesterday I woke up, and now that I'm focused Monday through Friday working, there's my habits are changing, because Monday through Friday I don't have time to just go to the grocery store, so I need to get all my things done on Saturday and Sunday. And so like yesterday I went and filled up my Jeep, and then we have a third car, kind of an extra car we keep, and I just went to the gas station and got that filled up. So, because I don't want to deal with that during the week, just fill it up on the weekend. It doesn't take long. And yesterday I went to the grocery store, and I was thinking, because I used to have just freedom to go to the grocery store at a drop of a hat, at a spur of the moment. Oh, I need this, I'll go to the grocery store, just for one or two items. But yesterday I had to think, okay, what's going to last me the week? So I had to get enough of this, enough of that, and just to make sure, do I have enough until next weekend? And so a few little changes in my lifestyle, and, but I was charged up. I did my laundry yesterday, which I never had a real laundry schedule. I just do it whenever I had a load. So, but yesterday I did my laundry, and now I'm doing a load now, washing my bed sheets and all that. So, those are things that I'm only going to be able to do on the weekend. I don't want to, deal with it during the week. Just really just focus on, getting my exercise, and, going in and doing my 8 hours. So yeah, I feel great. I'm back on the saddle, and just working. It makes me feel good. And I know a lot of people, they don't like to work, but I've never been one of those. And I like to get out, and I like being outside. And in this case, and because I work for the hospital, they know my medical background, so they gave me a job that fits, my age and my situation. So what I do is I drive a hospital van, and I deliver pharmaceuticals to patients at their home. And so that it's not a hard job. I might have 20 stops. And so yeah, there's some people. I mean, I always went to the pharmacy and picked up my medication, but there are some people that who who need their medication and various supplies brought to them at their house. And so that's a good service. And I mean, I had that service available to me, home delivery, but because I lived near the pharmacy, and it was no issue for me just to go over there and pick it up myself. But I did try the home delivery for a short period of time, and it didn't work for me because if you're not home, they will not leave your medication outside the door like, an Amazon or UPS package. You have to be there to accept it and sign for it. And they'll just put if you're not there, which that happened to me, and they just put like a note on your door saying, hey, we were here at this time, we'll come back tomorrow and give it a try. And so you don't know what time, at least for me, and I noticed even, the deliveries I did, there was no time frame. You just call them and say, hey, I'm about 30 minutes out, is that good? And we had a few, I think a couple who didn't pick up the phone and they weren't home. And there was one, he wasn't home, but we rang he has a Ring doorbell, and he started talking to us through the Ring doorbell. He wasn't home, but he asked if he can get, if we could allow a neighbor to sign for it. And we do allow that. We do allow that. In this case, his next door neighbor came out and received the package and signed for it. And in most cases, we allow that. But if it's like a super serious medication, absolutely not. And so but yeah, that's like I said, I did try that service and it didn't. I mean, unfortunately, that I can drive, I can easily go to the grocery store or the pharmacy. Everything is near me, and but that's what my job is, and I like it because I'm out and about, I'm driving, and I'm on my own, and that's it. So I can see myself doing this job for, I won't say forever, but I could definitely see myself doing it for a while because it's a good fit for me. And but ultimately, you never know where life will take us. But for now, I'm happy, and that's what's important. So, anyways, I will cut this video short, and so I just wanted to give an update where I'm at, and and until then, just be positive. Always be positive if you can. And there was times during my situation I had some negative thoughts, and but just be positive. Try to eat right and take those meds. Take those meds. I mean, I have an alarm set. I have to take meds every day, 8 a.m. and 8 p.m. And even though I like to sleep in, when my alarm goes off at 8 a.m., I take my meds. I have them right at my bedside and with my cup of water, and then I just go right back to sleep. So, at 8 p.m., my alarm goes off on my phone, and I don't care what I'm doing. I drop what I'm doing and get my meds. And so far, so good. And that's whatever there's apps you can download to remind you to take your medication, and I used one of those already. That's because that was in the past when I was taking medications at different times throughout the day, but now it's just 8 a.m., 8 p.m. And so but anyways, over and out for now, and until next time, see you then.